Hello and welcome. Today I'm going to show you the last speech pathology appointment I had before we decided that it may be best for me to go and look into getting a revision to my glottoplasty. So that is what I'm working on getting done. Partway through doing this appointment, my power went out. So you'll see I only have limited footage available, but it's there, and if you find it useful, great. I hope you do. Here it is. Hi.
Hello. How are you?
I'm good. How are you?
Good. Very summery where you are.
Well, it is right at the moment. We were just having a thunderstorm.
Okay. Yes, I feel like that's what is in store for the rest of the week is just intermittent storms.
Yeah, certainly the rest of today.
Yes, yeah. I haven't really, yeah. It's sticky. That's one thing I don't like.
I don't like that either, yeah.
But it looks like you have like a little breeze coming through at least.
A little bit, yeah. There's a little bit going on.
Some bird noises.
Yeah, I love the birds.
Yeah. I currently have I have like a little awning outside of my door, and in there is a bird's nest. And I just saw today there's two little chicks in there, like hanging out, waiting for food. I was surprised that they would make a nest there. It's such a like high traffic area, but I'm just
They do all kinds of crazy things, for sure.
yes. How have you been? I got your link that you sent me last week for the video, and I watched it, and I actually, yeah, I really enjoyed your commentary about makeup. It made me kind of think about it. Obviously, it's a very different relationship potentially, you know.
Well, yeah, I mean, it's like I'm not raised with it in the same way. I mean, I watched my mom do it forever, but yeah, it's
But I think that, you know, also as like cis women, that's like a good perspective to have of like you don't have to do it if you don't want. If you like doing it, then great, you know. But just this feeling that like you have to put it on in order to be like
acceptable, yeah.
Yeah, presentable, or you know, or like there's been times where I don't wear it and people are like, are you sick? Like, are you tired? You look tired today. I was like, this is what a normal face looks like when you wake up. Like, no, I'm not tired. Yeah. We're just like socialized to, you know, always see like a female face presented in a certain way.
We are, and I know a lot of trans women feel like that's what they have to do to fit in.
Yeah.
For sure. So I get that.
Yeah.
You know, it just makes it easier to be like, there's one more female thing to check on the box of like how to gender this person.
Right. Exactly. Yes. And then there's also like judgments of like this person's wearing too, like she's too made up, you know, and like is being fake, and it's just like, oh, just let people do what they want to do.
Exactly.
Like,
yeah.
It's not for anyone else to, yeah.
And everybody has their own relationship with it, too.
Exactly. Yeah. But also as far as your voice, I think in the first email you sent me, you said like, if you notice after the 5th minute.
Yeah, which is kind of true, yeah.
Okay. And I figured you meant that about this video, because initially you had sent me like a link to just a voice recording. But I was kind of paying attention. I mean, definitely in the beginning of the video, I can see that you're more attentive to your voice. And then there's a little bit like as you're kind of more in thought and go, you know, elaborating on your ideas, that fades away a little bit, which is kind of where, you know, you were when this all started, right?
Yeah, it's just less extreme now. Like now I'm at, say, 130 instead of 100.
When you're at 130 instead of 100, when you're like making zero efforts.
When I'm at the lowest point, yeah. And when I'm making an effort, then yeah, I think it's okay. And I think there's also part of my issue is just remembering to work more on the resonance and the diction issues. I think if I do that, then the rest of it comes. Well, mostly it cooperates. The other day it was not cooperating at all, and I couldn't get any words out. But for the most part, yeah, that's the case. And like you said, when I get more into my thoughts, then I'm just like not paying attention to my diction at all, or the way I'm holding my throat.
How are things as far as, like, I know last time we talked, there's also some kind of like issues with roughness, and a little bit of, what you were talking about, like that fry quality. Is that, and we talked about that, maybe that has to do with just the vocal cords being kind of inflamed.
I think to some degree
Like
that,
that's
I feel like more of that is just, it's when I get down to the lower frequencies, then that's what my vocal cords kind of do now, because they don't work in the same way they normally would. So like when I get down into the lower, then it just gets really gravelly. And then I just relax, and then it sounds really, yeah. Actually, it's not doing it so much today, but every day is different. I guess I am still healing.
okay.
My photos of my larynx finally did show up on my chart, so I was able to look at those, and it looks a little inflamed, but it's kind of hard to know what I'm looking at, too.
Right. Yeah. That's, yeah, totally fair. Yeah, it's not something that's so like obvious that if you're not trained to look at vocal cords all the time, you might not appreciate
Right.
it. But it's just kind of at that, like, so if the vocal cords are a V, it's like this zone right here, the mid-membranous vibratory part just looked red and inflamed. And that's where, I mean, part of the surgery is basically like peeling away that top layer of epithelium, kind of like lasering it and then suturing it. And so the idea is that part that's been aggravated kind of scars.
Yeah.
And
I feel like that's part of the way I get that graveliness is that when I do relax the vocal cords, then that lower section vibrates, and that's what sounds really gravelly, I think. So I'm not totally sure, but I mean, partly because it does sound so bad, it's been a good training for me to use my voice in a different way. Because I don't want to sound like, like that, which is not even always easy for me to get to, but if it's down here, then I just think, it doesn't sound very good at all. So if it's up here, I just keep my focus on not only adjusting the shape of my throat, but also the frequency up. Then I think it sounds pretty good.
Yeah, I mean, like right now as you're talking, I think it sounds really good. What do you feel when you're saying, and then I adjust? Like what do you feel like you're doing when you're making those adjustments? Like, can you?
So, well, I'm speaking at a higher frequency, but I'm also kind of closing off the upper portion of the top portion of my larynx area. So that gets a little bit more pressure coming in, and it reduces the bass resonance to that. So it's less about the mouth space, which would be good for me to focus on too, to do the mouth space as well. But
more about making the actual.
But it's really more about
throat.
it's about the upper throat tightening down.
Okay.
Because it seems like the frequency is good, But when the biggest change is, or the most important change is making sure the resonance is also matching the frequency.
Right. So the resonant, the frequency is kind of just your fundamental baseline, but then when you're working on the resonance, that changes the different like harmonics. So yeah, small spaces, higher frequency harmonics.
Right.
That can really affect the overall sound, just like I'm not really changing my pitch, but I'm just making the back of my throat really big, and so it sounds more of that like really small, which is kind of what twang is if you really exaggerate it, which is what we talked about last time. Again, aesthetically, that can sound a little bit like brassy or like too bright. It's like the extreme of bright. Because we do kind of want to highlight the bright overtones versus the darker ones. But again, it's like playing around with it. Like it seems like you have been to find.
Yeah, I have been. Just as a side note, I found an outtake from The Nanny, and it's one where she eats way too much wasabi and she speaks normally for like 5 seconds. It's kind of funny.
Oh my gosh, that's really funny. I actually, well, I've never heard, what's her name?
Fran Drescher.
Fran Drescher. I've never really, like, has she been in anything else? Like, does her voice, is that a voice she puts on, or is it just like a slightly exaggerated version?
It is a voice. It's an exaggeration of kind of what she grew up with, I think. It's kind of like a character she does.
Yeah.
I don't know how much of it is actually her.
I use that as an example when I'm teaching people twang, because we use it in other patients who, they might have like a weakness to their vocal cord, and it helps to kind of get better closure, essentially. And so I'd be like, think of that, or Janice from Friends is another one. Chandler.
It's very New Jersey.
Yes. Yeah. And obviously, and I think I mentioned that before, like when you're kind of learning and trying to train how to do it, you do it at a 10 out of 10, like really kind of extreme to be able to find that place, and then fine tuning it
right
to where it feels a little bit better. But which it seems like you have.
I think I've done a lot of that. It's just like part of it too is just like the fine tuning it so I don't have to think about it, getting it to be second nature, so it just feels like how I talk.
Hi.
Hello. That was odd. I even have a UPS that's supposed to keep my computer on, but it did not work.
Oh no. Is your power still off?
Yeah.
Or
this is just my phone.
That's your phone. Okay.
Let's see if I can get this.
Sorry that happened. Is it from the storms, maybe?
Must be. There's a bunch of thunderstorms going on.
Okay. Okay. You were saying. You're saying.
Something about my habits, just like getting used to doing it all the time, I think. So it just feels like my voice. Which is actually one of the advantages of not doing this has been that's been a lot easier. Sorry, it sounds like we're getting a lot of feedback.
Yeah. It sounds like a little bit muffled at times and then more clear. I don't know why that is, but.
Yeah, like sometimes it's blocking my voice out, but most of the time I can still hear my voice coming through your microphone. For whatever reason.
Let me see. I'm going to put in headphones. Sometimes that makes it less. So, can you hear me now?
Yeah, I can hear you.
Yeah. Okay. Is it less feedback on your end?
Testing. Yeah, that sounds a lot better.
Okay, awesome. Yay, headphones. Okay.
Yeah. No more feedback.
Yeah. I think it's something about this computer that, I don't know. I feel like that shouldn't happen. Like they should build the mic and the speakers far enough apart where it's not.
Well,
doing that.
it's always been a problem. They've just gotten really good at taking it out with a computational stuff. So like that's why speakerphones on cell phones are so much better than they were in say like the 80s or the 70s, where you couldn't have two people talking on both sides. It just didn't work at all.
Yeah. Okay. So you were saying you're just working on
Practice, I guess you could say.
Practice. You said, you were saying I have the advantage of. I think that's the last thing I heard you say.
Well, I had the advantage of just not speaking at all for a while, and so when I would start speaking again, it seemed strange. It was still strange because it wasn't like with the voice I'd been used to, but I was expecting something different at the same time. It's kind of a weird psychological thing.
Yeah. Do you feel now that, you've been playing around with the resonance and making some adjustments and that when you're kind of locked in, you're happy with the voice that you're producing?
Yeah, I think so. For the most part. I mean, I suppose it still wants a little tweaking, but I'm getting closer and closer all the time.
Okay. And then, how are you feeling about potentially like additional surgery?
I'm really not sure. I kind of wonder if I feel like maybe I should wait for it to heal more, or wait. I would imagine the doctor too would want me to wait till it was just completely healed. I mean, I don't know that. It's just a guess, but I mean, it's a little bit frustrating for sure that I have to spend this much time working on it, but yeah, I don't know. I guess I'd have to talk with him to see what the possibilities are.
Yeah. And I chatted with him a little bit after I got your first email. Because I think after, when I talked to you last, you had seen him recently, but I couldn't really, the note wasn't finished, so I couldn't see kind of what he was.
Yeah, I know, that only
thinking.
got uploaded recently.
And so I was sort of asking him, what do you think? Do you have intention, or do you think it's a good idea, or it makes sense for it to do a revision? And I think he was left with the impression that, even though the web has, come apart significantly, it's really more guided by, how you're perceiving it and how you feel about it. I think he was sort of left with the impression that you're but I feel happy about where it is, where I was sort of left with the impression that you don't. So,
well, yeah, I think it's been changing because it hasn't stayed the same. So, yeah, I think I was a lot happier when I saw him than I was later on talking to you.
Okay.
And I'm still not sure. I think, I have been kind of disappointed, but at the same time, I feel like I should probably wait a little bit longer for healing to happen before I even go back in there again. But that's just a guess. I don't really know. And maybe it's just if I work on my own skills a little bit more, then it won't be such a big deal. But like I said, I think I probably should wait because it is still changing. I don't feel like it's stopped healing, and I don't think I feel like I've hit a steady state. So I think probably it would be a good idea to hit a steady state before making a revision.
Okay. That makes sense. I mean, I will say, just from experience of seeing other people go through this, the revision is not uncommon. And I think we're sort of all like learning that as we go as a team, to help us sort of like set better expectations for people. But I think the way you're thinking about it makes total sense. I think people that come out of it and are just like, they're in a place where they have like a barely functional voice, and they may be more eager to do the revision sooner than later. Where, like you said, yours is still kind of like inconsistent and modifying, and like sometimes it is pretty good. So I get how you might want to wait and see if you can get to a good place without, because I'm assuming in an ideal world you'd rather just not have to have any more surgery.
Well, it's kind of a balance. It's not just, I mean, sure, I don't want to have more surgery, but I want to have, but more than that, I want the good outcome. So, but I don't really know what that is because, like I said, it's like it's all over the place. Like last Sunday when I was trying to talk to somebody, I just couldn't even get any words out for a while. So it needs some practice. And yeah, I think using it more would probably be helpful. Like, I guess I haven't been doing a whole lot of practice since the last time I saw you. So, I never got any updates from you. I don't know if you sent them, but I didn't see them in my inbox. And I forgot all about it. So
as far as what to practice?
Yeah, from our last session. I
think from our last session we were kind of talking about working on the twang quality.
Yeah.
So as some...
And so I've done a bit of that, for sure. So that's been something I've been doing. But it's also just, I guess, focusing on how I'm using my voice. Trying to sing is still really difficult. So.
Yeah. I could see that. Just to go back to, you said, the other day I was trying and like nothing was coming out. What does that mean? Like no voice, or
no,
just
it was
really
like
rough?
it was just like very froggy, like kind of like I had a ton of mucus on my vocal cords or something. I'm not really sure, but it was like they were not responding. I wasn't able to really get words out in any sort of clear manner.
Okay.
And so I think that's kind of still a problem too, is like once I get further along in a conversation, then my vocal cords start to get a little bit tired, and then it's hard for me to keep the pitch up.
Okay. Is that, I know that was a kind of an issue before the surgery.
Yeah.
Or that was one of the big issues.
It is. It's not as big as it was, but it's still an issue.
Okay. Gotcha. Yeah. Well, and I think the idea behind the surgery was to make that piece easier.
Sure. For sure. It just seemed like maybe we lost too much when it opened up.
Yeah. Yes.
And I don't know
if initially, in the kind of first few sessions, you definitely had that higher, it was breathy, more so. But it seemed like you did kind of have that higher pitch with less effort.
Yeah, I didn't have to try at all.
Yeah. Yeah.
So I don't know when it opened up about exactly. And I don't know if there's anything I could have done to prevent that, but...
I don't know that there is. I mean, you know, I'm sure you follow the voice rest recommendations, and I don't know if it's, you know, about how the procedure is done, or like how your body's healing process. You know, everybody's a little different.
Sure.
Like I've seen people where it's like first time and it stays, and other people where they've had like opening underneath the stitching, so it's like this part's still together, and
So
then there's
an
a little
extra
bit.
hole.
Yeah. Which was really frustrating because it's just like creates a really unstable, airy voice. So, and that was just really unexpected. Like that patient was very compliant with everything that we wanted them to do, but they were just not healing well. So it's just hard to predict, unfortunately.
Yeah, I can see that.
But I think typically following revision surgery, the outcomes are pretty positive.
Yeah, well, I think that makes sense. It seems like with a lot of surgeries, if they don't, there's only so much you can do with one surgery. You know, there's kind of a limit to what can be changed. So if you're already halfway there, then it's going to be easier to make the changes you need to.
Yeah. And you kind of have a little more information going in the second time about, you know, how the body heals, or they can kind of position the stitches in a different place, or like anchor them in a different way, I think, to prevent them from coming apart sooner. So, yeah, I don't know a ton about that.
Okay.
But
yeah, you're not your specialty.
No, my specialty. Just kind of hearing them talk about it and seeing some of the photos. But also, like, I have a patient who had a revision, and it's just so much happier after that. So.
Okay. Well, it kind of sounds like maybe I should try to make an appointment with the doctor about in a month or two.
Yeah.
To check in.
I think that'll be good, and kind of go through the procedure, see how things look, and then discuss what the revision would look like.
Okay. That makes sense.
And then, there'll be another round of healing, but, you know, hopefully that result you had in the beginning sustains as you, like, heal instead of kind of the back.
Yeah, I mean, I would think it would. And who knows, right? Nothing's guaranteed in life. But, I would think so. And I'm getting up on 6 months now from the surgery.
From the initial?
Yeah.
Yeah. It seems like a good timeline. And I'll see Dr. Nero tomorrow in clinic.
Okay.
So I can kind of share what we discussed and see what he thinks is a good timeline for you to come back in.
Okay, that sounds good.
And then I can just email you tomorrow.
Great.
And let you know what he says.
Great.
And then you can decide. But I think that's going to be the thing that helps reduce the effort. I do think, definitely if you practice more, potentially the effort will decrease to a certain extent. And that is, more practice will be good. But, I think, like, you've honed in on the resonance part, on some of the oral resonance, the throat resonance, the prosody is good, the articulation, like all other pieces are in place. I think the effort is because the pitch isn't reliably staying where you expect it to.
It's true. I mean, overall, it is a big improvement for sure. I feel like already it's much less likely for me to be misgendered on the phone, which is really one of the main things I was going for. But
Yeah.
but yeah, it would be nice to polish it up so there's, it's all the way there.
Yeah. Yes. Yeah, and even just like today in this session, I think your voice is more consistent throughout versus the last time I saw you like a month ago.
Oh, that's good.
Yeah, I've been kind of sort of like keeping an eye on the pitch up as we're doing this, and I would say like 95% of the time you're, between like 160 and 220.
Which is great.
Which is great, yeah. I think as long as it's not, dipping below, like, I think 150 is kind of a good goal.
I agree.
To not go below that basement point. And it's not, it's not rough, it's not sounding strained, it's not breaking on the higher end. So yeah, it's just more about, the effort piece now.
Mm-hmm.
So okay. I think that's what the surgery would help with.
Yeah, I think so. Just to make it so that, I guess that's been the goal all along, that I just want my voice to be my voice. I don't have to think about it. But I don't think that's really the case for anyone, especially for women. Women are always, they've done CAT scans of women's brains, and they are always processing for tone, whereas men are not. I think it's just how women are.
Interesting.
We're always thinking about how we sound as well as what we're saying.
Yes. I think there is definitely greater awareness. Yeah, I don't think it'll ever be like zero effort, but
right.
You just want it to be to the point where you can create more mental space for what you're saying and kind of being present in the conversation versus the voice.
Yeah, exactly.
Yeah, that makes sense. But as far as exercises or tasks, I don't know that there's anything more that I can give you.
That's fair. We've gone through a lot of stuff, and it seems like mostly I just have to practice now.
Yeah. And then, okay, so let's plan to, I'll talk with Dr. Neo tomorrow. I'll let you know what he says as far as timing. And then...
and you can either have... you could have them reach out to me to set up an appointment, or I can just send a request if that's not convenient. Either way.
Okay. I can do it through our scheduler. Yeah. Yes. That'll be easier.
Yeah.
And then we do have an appointment on the 6th scheduled. And
do you think that'd be useful, or should we reschedule it for further out?
I don't know that it would be very useful. Just in terms of, maybe if you're like, I know I have this upcoming, so I'm really going to practice for the next few weeks or something. But I think if we're sort of going in the direction of pursuing the revision, at this point where you are now, I don't feel like I have a ton more.
Right. Yeah, we've kind of gone through all the steps, it feels like, so that makes sense. Have I lost you? Hello?
Hi, Valentine, it's Flora.
Hey. My internet just went out, so...
Your internet? Okay, it's okay. We can just kind of wrap up on this phone.
Sure.
Well, I was just saying, as far as your next appointment, I don't know that it would be particularly...
Sure. So we can
official.
cancel that and
okay.
just maybe set something up with the doctor.
Yes.
For,
and then, probably, pick up for a few sessions post surgery.
Right.
But for now, I think kind of like you have all the tools that I can give you, and it's just, about tweaking and playing around on your own like you have been. Just practicing.
I think that sounds good.
Okay. Great. So, I will email you tomorrow once I talk to Dr. Nero, and I'll let you know what he thought, and then I'll reach out to the schedulers as well, and then they'll call you to set up the appointment.
All right. Yeah, that sounds good.
Okay. Perfect. All right. Well, I'm sorry this has been such a journey.
Yeah, it really has. That's kind of interesting. Like, actually, since I had facial feminization surgery at the same time, it's been that was such a walk in the park compared to this. I guess that just shows to you how important your voice is and how much you depend on it.
Yes. Yeah, absolutely. Yes. Well, I hope that we are in the final stretch now. And if things come up in the meantime, just you can always feel free to reach out. But expect to hear from me tomorrow.
Okay.
Steps moving forward.
Yeah, that sounds good.
Okay. Awesome. All right. Well, have a good rest of your day. I hope you get your power back soon.
Yeah, me too. I was hoping to do some cooking, but we'll see.
All right. Well, I'll talk to you later.
Have a good night.
You too. Bye.
Bye. I hope that was useful to you. Be well. Be blessed. Be fully at peace. Be fully enlightened. Be fully endowed. Be completely filled with love for all other beings. I love you. Aloha.